So you're using lasers now. So how have lasers changed dentistry?
Well, you would be surprised. Some people actually, they aren't pleased with the way their color of their gums look. So we actually have lasers now that can change the color or tone of their gums. A lot of people, when they smile, if they have a large smile, that you can see their gums, and we're able to change the color of their gums.
So if it's discolored, spots, whatever.
Right. If it's dark pigmentation, sometimes we're able to fix that with the laser if that's what they want.
What else do you use the laser for?
It will make our extractions less traumatic. So it's the newest technology in dentistry. We can use it to improve the way that we take teeth out. We can use it to contour their gums if they feel like they have showing too much gum when they smile. We can use
like a gummy smile. You can kind of.
We can contour it so that they don't show that so much.
And what about like cavities and things like that? Are you able to use it for that?
Sometimes you don't even have to numb the patient. You have the laser and you're able to do the cavity preparation and fix the tooth without even numbing them.
So slowly the drills are going away.
The drills are going away. Pain-free dentistry, no numbing and no drills.
Even like the goop that they put in your mouth. You guys now have like wands that.
We do. We're able to do 3D intraoral scanning, which allows the patient to see all of their teeth, pictures of their teeth, 360 degrees rotations around their teeth. We're able to look for cavities with computers now, so you're not just relying on the doctor to look for decay. You can see in between the teeth better, and patients love looking at themselves with the intraoral scans.